My name is Ferry, and today I will be comparing the health care system of the United States to that of the Slovak Republic, or better known as Slovakia. The differences can be seen at the very foundation. Each country has a different healthcare system. The United States has no single nationwide system. Health insurance in the United States is purchased in the private marketplace or provided by the government to certain groups. Private health insurance can be bought from a wide range of for-profit commercial insurance companies or from non-profit insurers. Slovakia, on the other hand, has a universal healthcare system. Healthcare contributions are mandatory and are paid to the health insurance company of the employee's choice. There are currently 3 healthcare companies to choose from, one of which is owned by the state and the other 2 are privately owned insurance companies. Those who make more contribute more, and those who earn less contribute less. This is what they call the solidarity program. So no matter how much you contribute, whether it be more based off how much you earn or less based off how much you earn, you still get the same healthcare system and coverage. In the United States, the total average life expectancy is around 78.69 years, which is higher than Slovakia's, which is 76.563 years. This trend continues when life expectancy is broken down between males and females, so men and women. In the United States, the average life expectancy for men is 76.3 years, and the average life expectancy for women is 81.2 years. This compares to Slovakia's life expectancy for men, which is only 73.2 years, and for women is only 80.2 years. The reason Slovakia's may have a shorter life expectancy could be due to the higher average behavioral risk factors, such as smoking, alcohol consumption, dietary risks, and low physical activity, meaning they have a higher number of people who smoke and consume alcohol and who eat less healthy food options, and those who are less active than the United States does, so their life expectancy is shorter. Another difference that can be seen is the total healthcare spending per capita. In the United States, the total healthcare spending per capita in 2014 was $9,403. This number has gone up, and in 2016, it was $10,348. Healthcare spending per capita looks at how much money the United States would have spent per person on healthcare that year. That means that for every one person, they spent $9,403 on healthcare. In 2014 and in 2016, the $10,348. In Slovakia, the total healthcare spending per capita is almost 5 times less than that of the United States, with Slovakia only spending $2,179 US dollars in 2014. Slovakia's spending per capita has also increased in 2016, but it stayed below $3,000. The United States spends a really big amount per capita on healthcare, and that is something that needs to be looked at and needs to be addressed when trying to advance our healthcare system. An important aspect to look at when comparing healthcare is the number of preventable deaths prior to the age of 75 per 100,000 people. This information shows how effective your healthcare system is at getting patients access to the healthcare and the healthcare's effectiveness. In the United States, the number of preventable deaths prior to 75 is 125 per every 100,000 people. So for every 100,000 people there are 125 deaths that are preventable. In Slovakia, that number is 210 preventable deaths per 100,000 people. So that's 210 preventable deaths for every 100,000 people, which means that those people aren't getting the effectiveness of the healthcare system that they're paying for. Vaccination rates are another important health factor to look at With these numbers, they're looking specifically at children aged 19 to 35 months. In the United States, about 91% of all children aged 19 to 35 months are vaccinated, which is awesome. And in Slovakia, this number is a little greater at 96%. The number varies from vaccine to vaccine, but this is the overall percentages that each country has of those who are 19 to 35 months being vaccinated. As we have seen throughout this presentation, there are a lot of factors to look at when examining a country's healthcare system. An aspect we have not addressed yet that is still very important is the country's physical environment. Specifically, I'm going to look at the access to safe drinking water. In 2016, more than 90% of the nation's community health water system passed the more than 90 U.S. Environmental Protection Agency standards. The water in the U.S. is regulated by state and federal laws and codes which set maximum containment levels for some pollutants and naturally occurring constituents, among other requirements, meaning that 90% of our water that we drink was past very strict regulations and rules regarding what can be contained within that water to keep it safe for us to drink. Slovakia's government has a similar system where they look at a set of 82 water quality parameters instead of 90 that are also set by the government to look at the safety of their country's drinking water. And about 86% of their waters meet those standards, and they have one of the largest naturally occurring water in the world. The ability to see a doctor when needed is a big aspect of a healthcare system. In the United States, for every 100,000 people, there are 256.8 physicians ready and willing to help. In Slovakia, the number is higher, with them having 345 physicians per 100,000 people. It is a little shocking that a country with 325.7 million people would have less physicians than a country with a population of only 5.435 million people. However, looking at aspects where the United States falls short helps to express why we as a country need to focus our improvements on these sorts of efforts. Aspects that have a big impact of societal health is both the social and economic environment of each country. Part of this environment is looking at teen birth rates per 100,000 people. Looking at this helps to express the importance of health education and awareness, especially within the teen population. In the United States, for every 100,000 people, or every 100,000 teens, there are 2,061.5 teens that give birth each year. In Slovakia, that number is a little higher at 2,215 teens giving birth. These numbers are both high and indicate that there is room for improvement for both healthcare systems in awareness, prevention, and education. Through this presentation, I hope you learn that healthcare affects and is affected by everything. Social, environmental, and economical factors all affect the way in which healthcare systems are implemented and carried out. This helps to explain why some systems are better in certain areas than others. However, that does not mean that what works in one country cannot work in another, and that what is implemented in one country cannot be implemented in another. In fact, comparing healthcare systems can help both countries find solutions for their issues. Comparing systems around the world can provide countries with new ideas to improve their healthcare for the greater good of their countries. While the United States and Slovakia seem to be super different, especially from the very foundation, they are affected by the same issues. People are people. And comparing them can bring about new ideas on how to solve bigger issues. This project helped me to learn just that.